I knew I was dead. I mean, I knew I was going to die. I was very calm about it and just said, Lord, is this it?
For Marjorie Loomis and her husband Gaston, a trip home from Mississippi to Georgia ended on the I-10 near Pensacola, trapped upside down in their SUV.
When I landed and I felt all of this muck going into my mouth and I couldn't stop it and I couldn't breathe, I didn't think I would make it out of the car. Then the next thing I remember was somebody saying, we can't get her arm.
Just 2 weeks after the accident nearly claimed her life, Loomis was back in Mississippi at Methodist Rehabilitation Center, struggling to recover from the loss of her dominant left arm.
I want you to imagine that it's your left, open and closing, okay? It's your left hand. I want you to think about that hand, opening and closing.
A variety of therapies and technologies are used to help amputees regain their balance and center of gravity, and in Loomis's case, mirror box therapy is used to help her cope with phantom pain.
That is actually a very simple type of therapeutic device. It's simple in the concept, but it actually, when you think about it, it works on very complex pathways in the brain.
So it kind of tricks the brain to think the arm is there still.
Exactly. So basically, that's what it does. It's kind of replacing the picture of the injured limb by the image of the non-injured limb.
So kind of in her mind's eye, she will, if she does that enough, the brain will be tricked into thinking the arm is still there, there's no real problem, it's...
Correct.
Everything's fine.
Does this concept kind of make sense to you? Does it...
I think it's helping. I don't know quite how it's helping. You know, on the one hand, I know about neuroplasticity and all of that kind of thing. I can't actually feel that, so I can't really explain it. But maybe I am training some nerves to go another way. And if you could train them to go another way, maybe they can get lost and forget that they belong to your left arm. I don't know. It's very strange how it works, but I think it is helping.
Mirror box therapy is also used at Methodist Rehabilitation Center to help stroke and traumatic brain injury patients overcome neuropathic pain and for neuromuscular retraining.
Some people feel an immediate relief from that tense sensation or even the painful sensation, and that can cause immediate pain relief. Some people at least report immediate pain relief. Some people cry just because they're moving the limb or whatever it is. So that's how powerful the first experience is.
Amazing how something so simple can be so meaningful.
Very simple.
It's the new way to treat phantom pain.
Has it been used successfully in other places? I guess
it has. There are other hospitals that are using it. The VA hospitals use it quite a bit with the guys that are coming back from the war.
You know, I am 79, almost 80, and you lose a lot, I think, of your willpower, or your, I mean, maybe you're just kind of set in the way you think. But now I have to make a whole new me, and that's what I'm working on. And I think I'll be able to do it with a little help from here and there, and a lot of help from these folks here. They've been really wonderful for me.
Having an arm amputation, you wouldn't think about it, but it kind of throws your whole center of gravity off. So we had to start back challenging her sitting balance and her just her standing balance. But when we first started walking, she could walk about 15-20 feet. Her endurance was down, her balance was impaired, like I said earlier. But now we're walking about 300 feet. She's managing a rolling walker by herself with one hand. She's really made a lot of progress in a short amount of time.
And you would think in an older person they might have less of a desire, less of motivation.
Absolutely, but not her. She's not going to let this stop her.
Hey, as far as I'm concerned, they can keep me in here all day.
All right, you ready to do some walking?
I'm Jim ALBRITTON reporting.
Take it off.